Strategy and Insider, exploring future trends and their impacts.
Hello, everyone, and welcome to another episode of the Strategy and Insider podcast. I'm Thomas, your host and a partner at Strategy and. In this podcast, we explore the cutting-edge transformations that shape the future of health, with a special focus on how technology advancements are redefining healthcare and the pharmaceutical landscape as such. Today, we have the privilege of speaking with a founder of health tech applications, who is a true pioneer with over 20 years of experience in applying AI to empathetic healthcare solutions. And with profound expertise and a visionary outlook, our guest is the perfect fit for our podcast, as I would say. So please give a very warm welcome to Loren Larsen. Loren actually is the CEO and co-founder of Videra Health, which is a leading AI-driven behavioral health assessment platform that uses video and artificial intelligence to evaluate and measure health with a particular focus on mental health. Before Videra, Loren was the CTO of HireView, which is a video job interviewing platform that leverages sophisticated machine learning algorithms. He also co-founded Nomi Health, which is a direct healthcare company committed to innovating within the healthcare service and technology space. With over 20 years of extensive experience in engineering, research, but also leadership, Loren holds more than 25 US patents. His projects do range from creating video relay services for the deaf and hard to hearing to groundbreaking gigabit Ethernet, reliable high-definition video streaming, and also on-demand video job interviews. So quite a variety. Additionally, his expertise spans the development of tech that can interpret human language as well as emotions. So taken together, Loren is what I would consider dynamic business leader, reshaping the healthcare technology industry with a very clear vision for developing responsible technology to transform interactions between individuals and healthcare providers. So that said, I'm really thrilled to welcoming him to our podcast today. And can't wait really to dive into our conversation. Thanks for joining us, Loren.
Thanks, Thomas. I'm really excited to chat with you today.
Super. In prep for today's episode, I learned that in your free time, you do enjoy beekeeping and running. So quite some activities that are different from your technology-focused professional life, I would consider. How important is it for you to really disconnect from technology these days? And how do these hobbies contribute to your personal mental well-being?
They're very important. I'm better at saying that I should do it than I actually do some of those things. It's very easy to just get stuck into work and just keep going. But I know that when I get out on a run, and we live here, I'm in Utah here in the United States, and I live just at the base of the mountains, and I can get out on beautiful trails and run. And I know that my thinking clears up and I can just let my thoughts go. And I always come up with some interesting insight when I come back from a run. Which you'd think would make me do it more often, but it's really important to just stay balanced. I know I do my best work when I get out and move my body, get some fresh air. There's a lot of research that supports that as well, that says that's really important for everyone's mental health, is to get out in nature, but it's really valuable for me.
I can so much relate to that, both to nature and to doing sports, but also to that ambition sometimes is higher than reality, right? So totally relate to that.
Absolutely. And I also learned that I have an allergy to bees this last year. I made the mistake of going to my beehive without the bee suit on. Oh. And they took offense at that, and I ended up in the hospital. So I may be reevaluating my beekeeping activities in the near future.
I wish you all the best for that, of course. I didn't see that obviously coming.
Yeah.
Hey, I do find it very fascinating that you discovered a passion for computer programming already at the age of 11 and became a professional programmer by the age of 12. What initially sparked your interest in this at such a young age, and How has this kind of early start influenced your professional as well as personal journey?
Yeah, that's a great question. And like so many people at that age, you're influenced by teachers. And I had a teacher who had a passion for teaching kids to program. And for whatever reason, I found it just fascinating trying to figure out how to give these instructions to a computer to get it to do things, even though they were, silly things, like guessing a number, playing a quiz game or something like that. But I sold, when I say I was a professional programmer that young, it meant I sold a copy of a program to a teacher. It was like a spelling program for schools. It was not a big thing, but I sold a piece of software.
Great stuff.
And I think that, that's obviously shaped a lot of where my career has gone, is just being able to figure out how to build things with computers. And it's just an endless challenge of sort of, you've got this idea and how can you make it real in the world. And I'm not good at building things mechanically with my hands. And so computers were kind of what I was left with.
So your current work does focus around innovations within the mental health industry, which is a very particular industry, obviously, seeing where you're coming from also. When did your interest in psychology and mental health topics begin? Was that given naturally to you, or was there some sort of experience that ignited this passion for you?
As a teenager, I was really interested in psychology and just trying to figure out, I was a computer nerd. I was trying to figure out how to interact with other humans. And so psychology was a really natural place to go and do reading. So I was really fascinated by that. And I thought at one point, maybe I would become a therapist. And I also wanted to be a computer science professor. And I took the computer science path. I never became a professor, but that's the path I went down. But I was always very interested in both psychology and artificial intelligence. But when I was growing up, there wasn't that much you could do with a computer that would be considered artificial intelligence. And so it was more of I had books and I'd read things, but there wasn't much you could do. And so it's been really nice at this stage of my career to have come back to many of the things that I found interesting, have all sort of come together: artificial intelligence and psychology and computer programming. And so now I'm sort of combining all of the things that I've been passionate about my whole life. Some were just hobbies, and now they've become part of my professional world.
So now we're talking kind of more the specifics of what you're doing, right? And I really want to drill a bit more into your company, Videra Health. This actually offers AI-powered platforms that use videos, audio, but also chat interactions to capture behavioral symptoms and also emotional nuances to diagnose mental health conditions and tracks treatment also in real time. In other words, my or our facial expression, the tone of voice, the way we're writing things in chat conversations do transport essential information on the personal state of health of us. And you're also able to generate insights out of this. Can you elaborate a bit more on the concept as well as the technology behind this platform, which I obviously find fascinating?
Yeah, a lot of what we do at Videra conceptually came from a previous company that myself and one of my co-founders here, Mark Newman, created called HireView. And Mark created this idea of a job interview that was asynchronous. So instead of scheduling phone interviews with people, you could just create a set of structured questions and invite them to interview and record their answers on video. And they could answer anytime they wanted, anywhere they wanted. And you weren't really constrained by how many phone interviews your recruiters could do or your hiring managers could do. And so you could see a lot more people. And we learned a lot from that about allowing people to be seen and heard rather than being judged on a resume. A resume is not a very good way to evaluate a person. It may not be true, it may not be accurate, they may or may not have written it. And there's just things that come through when you meet somebody that you can never get from the written page. And we were really proud of that work, and that's where our work on AI from these videos started. But the question really became, how could you apply that idea to healthcare? And because helping somebody find a job is incredibly rewarding and incredibly life-changing for them. And so people asked us, could you apply that same idea to healthcare? And the analogy that we sort of came up with was, what happens in healthcare is you go to your doctor, you're seen, you get pretty good care, you get attention, and you're there with your doctor, whether it's 8 minutes or 45 minutes, you are seen and heard. And then you leave, and the patient is generally on their own. There's no one there with them. There's no way to follow up with them at scale. And so the patient is just on their own to figure it out. And we had built this way to sort of check in with people and ask them questions. Originally, they were job interview questions, but now it was, how are you doing? Right.
Mm-hmm.
And that was never really possible before in healthcare. And so we wanted to apply that same idea of just ask people questions on a regular basis that doesn't require humans to be involved, not because we want to replace humans, because there just aren't enough humans to check in on all the people that need to be checked in with as often as they need to be.
Yeah. So it's a very scalable solution. And I very much like the fact that kind of you bring healthcare and health management into everyday life and not only happening at a doctor's place, which is by and large anyway, an artificial setting, right? So bring that back into the here and now obviously makes total sense.
Yeah, so much of most of what happens in our lives does not happen in the doctor's office. Right?
Absolutely. I hope not. Yeah.
Exactly.
So, I mean, the mental health issues like depression, anxiety, and the like are obviously globally on the rise. And the World Health Organization actually expects by 2030 that depression will have become the largest single healthcare burden, costing overall not only depression but mental health up to 6 trillion globally. Yet mental health conditions do often go undiagnosed due to very complex symptoms. Among the use cases of Videra, such as clinical trial monitoring or the intake and discharge management, remote patient monitoring, as you just said, for mental health conditions, which are the focus of your platforms. Given this rise globally, but also where you're focusing, what are the biggest challenges of diagnosing, but also treating mental health illnesses virtually, actually?
Yeah, I think it starts with you get pretty good treatment from providers. I mean, there are good providers and there are bad providers, but we just don't have enough of them to meet this demand. And so I think we need to be able to free up our providers who are already overworked. Certainly in the United States, that's the case. There's a lot of administrative burden that is on them to take notes and fill out forms and paperwork, and really free them up to do what they went into this field to do, which is provide really good mental health treatment to the people who need it. And so I think that's kind of where we start, is how do we help these superheroes scale and help them do more of the work that they want to do, and let them see things that they can't normally see. So if you can, even if it's your primary care doctor and you walk into the primary care doctor and they already know that you're struggling with mental health, then they can spend that limited time they have with you on that. But today, you kind of walk in, they're fairly blind to what's going on with you, and then they have to discover all of this in that limited window of time. And so being able to see people before they get to the doctor, see how they're reacting to medication between visits after they've been given a prescription, figuring out if somebody's been in for treatment, are they going to relapse in their addiction journey? Do they need additional support? And just getting the right patients to the provider at the right time, I think provides a huge opportunity to optimize the very limited number of people we have who can provide this care.
We touched upon that earlier. Diagnosis in mental health is obviously still a problem. And still in recent years, the importance of an earlier detection in mental health has gained considerable attention among healthcare professionals, but also researchers. Identifying those initial signs and symptoms of mental health disorders before they actually escalate can lead to timelier intervention, reduction of stigmata, improved prognosis, and also cost effectiveness. Actually, recent statistics confirm that about 50% of lifetime cases of mental illnesses begin by the age of 14 and 75% by the age of 24, which to me underscores the critical need for early identification, but also intervention to mitigate the long-term impact of mental health issues. From your perspective, and you're actually applying it, right? How can technology, and particularly AI, help in the early diagnosis of mental health conditions? And what are benefits that earlier intervention do offer for patient outcomes from your perspective?
Being able to see these things earlier is really critical. And so many people suffer endlessly because it can take up to 10 years to be diagnosed, because these are complicated conditions that people struggle with, and they struggle needlessly. And so we want to eliminate that suffering by seeing it earlier, but the intervention can also be lighter.
Mm-hmm.
If people are struggling with something and we can give them mindfulness exercises, we can give them cognitive behavioral therapy, we can just help them learn about how their mind works and how to cope with situations, we can keep something from progressing and getting much, much worse. And even with medication, we know that if someone's giving antidepressants, it doesn't often work the first time. And so we have to try different medications, different dosages to get there. The earlier that we can start to do that, the better off that patients will be, and will reduce suffering. And not just the suffering of the patient, but sort of everybody around them who is affected by the mental challenges that they're having. I'll give you an interesting story that just came up recently. We've built an algorithm to detect a condition called tardive dyskinesia.
Mm-hmm.
And for those who don't know, tardive dyskinesia is a movement disorder where someone develops facial movements, can be full body, but sort of tics and uncontrollable movements. And it's really debilitating for people who get it. And it's caused by antipsychotics. So if you're bipolar, schizophrenic, major depressive disorder, in the United States, there are 6 to 7 million people on these medications. They can develop this condition called tardive dyskinesia. But it's very, very hard for a clinician to see it, and it's very hard for a clinician to see it early. And when we were building this algorithm that would use video to detect this earlier, the principal investigator on the project is named Owen Muir. And Owen has bipolar, he's been on antipsychotics. He was developing the symptoms, but he didn't notice it. His wife is a psychiatrist, and she didn't notice it. And he hangs out all day with people who are experts in tardive dyskinesia, and no one recognized that those weird little tics that he has are tardive dyskinesia. So it's not easy, even for people who are professionals at this, to see some of these things, even in people they see every day that they're close to. And that's part of that may blind them a little bit because it sneaks up on you. But even people who didn't see him every day didn't catch it. And that's just an example of how hard some of these things are to see, even for people who are trained. And that's why we feel really strongly that algorithms and like machines are not replacing the clinicians. We're helping them see things that they're just too busy, or maybe aren't trained in a particular condition well enough to see.
And that is obviously a very interesting interplay there, because while AI can significantly enhance, obviously, especially those mental health assessments, the discussion about the role of human characteristics like empathy and patient care is obviously as important. How do you balance the analytical capabilities and rigor of AI with the need for empathy and human touch in that mental health assessment?
Yeah, it's such a great and fun topic to talk about because there was recently a study that had AI, and I don't have the reference off the top of my head, but AI was interacting with patients, and it found that AI was more empathetic in many ways than providers were.
That is now scary, huh?
On the one hand, you kind of think, well, the provider at their best with enough time is probably going to be better. And I think there are certain things that will never be replaced by machines, like a human sitting across from another human, giving them their time and their attention. And maybe you could say even love, like they're like, I really wish the best for you and I care. I don't know if AI will ever care in the way that a human can. And the sense of knowing that another person is there for you and cares about you and is working to help you. I don't know if that will be replaced by AI. But the opposite of that is what we've learned from many years of research, even back in the job interviewing days when we were building job interviewing solutions, is that people are quite willing to share a lot of information with AI when there isn't another person on the other side. We have this desire to please the other person and say things that are socially acceptable and seek their approval and not be judged by them. And so when we're sitting across from another person, even if they have our best interests at heart, we might self-edit and suppress what we really feel. But we're willing to say those things to an AI that's dispassionate, has no stake in this, has no ego in this, is not going to judge me. And so in many ways, people are willing to share more with a machine that's dispassionate, disconnected in a certain sense than they would with another person. And this is actually helpful when we're doing these video engagements with people because they do share a lot.
And how can I kind of imagine this? You have kind of a Teams or phone call with them, and you just listen in, have kind of a conversation on the well-being of that person, and based on those that you probably also frequently or in a cadence with them, you can then predict deterioration of their disease or onset of a disease, or how does that kind of work?
Yeah, we haven't really talked about the mechanism of how this works yet.
If you could share that would be really cool. Huh?
Yeah. So the typical way that we work is that we work on some kind of what we call a program. And so we say, look, we want to follow up with this patient after they leave addiction treatment for 12 months. Mm-hmm. And so we want to check in every few days for the first few weeks. We want to check in every couple of weeks after that. That can be adapted to, like, if they're starting to go downhill or they're struggling, we can make it more frequent. Mm-hmm. And they're going to get a text message on their phone, an email saying, hey, we'd love to just hear how you're doing. Click a link on their phone. They come into on their web browser. They don't need an app. And then they answer some questions. So we'll ask them, like, basically, how are you doing? What's been going on the last couple of weeks? And then they'll answer that question. And while they're answering, the AI is evaluating what they're saying, both the verbal and the nonverbal. So the words and their affect and their tone of voice. And then, they might get in and say, yeah, I'm fine. Now that may not mean they're fine, right? And then, hey, it's great that you're fine. I'll kind of reflect that back. Is there anything else you want to talk about today? And then they might say, actually, I haven't really been sleeping so well. And it goes, oh, well, life can be difficult when you haven't been sleeping well. How's that affecting you? Or what do you think's causing that? And then they'll say, well, it's just I don't want to get out of bed in the morning, and I'm just really struggling to stay engaged with my daily activities, et cetera. And from that, we've trained these algorithms on well-established measures. Like there's one called the PHQ-9, which is a 9-question assessment for depression symptoms. And then we've had a lot of people answer these questions on video. And then we've trained these algorithms that now can predict that PHQ-9 score from the video and their answers. And so from their answer to this ongoing dialogue, we'll say, hey, when people talk like that, that means their PHQ-9 score is this. And so from that brief conversation, it's usually 4 or 5 turns of the conversation, a question and answer, a question and answer. We can measure their symptomology for depression, anxiety, trauma. Are they using suicidal language? Are they in what we call emotional distress? And there's about 10 other things that we're measuring from that interaction. So from the patient's perspective, they're investing 3 or 4 minutes, maybe 5 minutes. Some people really like to talk, and it's really cathartic for them to just have a place to talk about what's been going on. Maybe they don't have another place to do that. I think we all could benefit from that sometimes. And then we're measuring many, many things. And the traditional answer to that has been somebody calls them and asks them some questions, or you give them a PHQ-9, which is 9 questions. And if you've ever taken one, the questions are kind of awkward. You go, well, I don't know if that's often or not often. I don't know if that really describes what's happening. Like, you don't really feel seen and heard when you answer a PHQ-9. And then if you want to do anxiety, you do a GAD-7. So that's 7 more questions. And then if you want to do trauma, it's a PCL-5 perhaps. And that's not 5 questions, it's 20 questions. So pretty soon you're at 36 questions in the traditional way of measuring these things. And now we've replaced that with a 3 to 4 minute conversation, which they're just talking about what's been going on with them lately. And we're able to measure that from their verbal, nonverbal behavior. So that's how it works. And our goal is to learn as much about that person that's clinically relevant to help guide their care and get them to the right resources in as little time investment from the patient as necessary.
Super fascinating. And thanks for alluding very practically how this actually works, the technology and the questions, the type of questions that you ask. I want to just pivot a bit towards also parts of our life, which is the workplace. Given that mental health has been more reactive in the past, with many individuals often only seeking assistance once kind of there was a crisis for them. And there is an increasing demand for proactive mental health solutions, particularly in the workplace where we're spending a lot of time, be it at the workplace or also in the home office. Employees are seeking better mental health resources, and employers recognize also the long-term benefits of a healthier, more engaged workforce. And also we, in our strategy and future of health study, we also emphasize that the future of healthcare will be much more personalized, digitized, preventative, but the solution seamlessly integrating also into our everyday life. The healthcare management needs to happen in the here and now, as we said before, not only in a doctor's place every now and then. So given this context, what preventative measures can be implemented from your perspective to support mental health? And how might these strategies be effectively integrated into also a workplace setting where a lot of our lives are happening?
I think the first thing is recognizing that almost everybody in their life is going to go through a period where they struggle. And a lot of people are struggling who you have no idea. People can go to work and feel like, I'm the only one. Something's wrong with me. And struggle is, part of life. I don't think anybody has ever done anything which they didn't in some way struggle with anxiety or fears or bouts of depression or hopelessness. I think that's a natural part of human experience. And I think allowing that to be kind of acknowledged in the workplace, that we're not all just fine. We're not all perfect every day. People are going to have good days and bad days based on what's going on in real life. And I think there is a growing acknowledgement that that's the case and that it's okay to sort of take care of yourself. That can also become pathological, like, oh, all I'm doing is taking care of myself. I don't have time to work. I think there can be a dark side to that too. But even just like if you think about sleep, right? It used to be that you would go to work and be like, oh, I only got 2 hours of sleep last night. See how committed I am. And now people are like, that's not good for you.
Yeah.
And now people are coming in like, I got a full 8 hours. I feel great. But if you got a full 8 hours, you were perceived as lazy before, And so I think there's this like growing sense that we all need to take care of ourselves and that we're going to have periods where we're not at our best. And I think that's really healthy to give people space to sort of take care of themselves. And then I think that employers are doing a much better job at providing proactive resources, whether that's wellness, yoga, mindfulness, meditation. These are all becoming activities that help us regulate and calm the sympathetic nervous system and just function better day to day. So some of these things don't develop in the way that they might have before, where you were alone and had no resources. So I think there's a lot of those sorts of things that are really beginning to help. And then the last thing I will say, and I think we're really moving into this phase, and I think we have to be very careful with what I'm about to say, which is AI can not just measure, which is what Videra has focused on today, but also help. Mm-hmm. And somebody told me there's like 30,000 apps on the App Store or something that in some way purport to coach you or help you. And we don't really know how those work. And those haven't been scientifically validated in most cases. So we have to be careful with what those are. But, I have quite a number of friends who said, I was struggling with something and I just got on ChatGPT and asked it about this and what I should do. Mm-hmm. And it offered some suggestions, and just having a new perspective on, hey, have you thought of this? Have you thought of this? Is actually really helpful to people in a lot of cases to get through. Now, we're not talking about serious mental illness. We're not talking about, major depressive disorder. We're talking about the normal day-to-day, I'm struggling with some anxiety, some fear, to help people where maybe before they would have felt like I've got to go see somebody, which maybe they still should, but there's a waiting list. You can't get to somebody right now. And so for some of those, less acute cases, I think AI can be really helpful and supportive. And we've never had that ability to really have like an interactive dialogue with something or someone that on demand, anytime we want, at 2 a.m. when we're freaking out. And I think that's a really powerful resource that will continue to get better.
And as we talk solutions, kind of in a broader context, is there any kind of best practice strategy or technology that you believe is most effective in empowering individuals to take better control of their mental health? Is there anything that you can leave me personally, but also our listeners with, obviously, that you have seen from day-to-day practice that is most effective and efficient?
Yeah, it's a great question. I mean, I think some of the things I just mentioned, I think are helpful. I mean, I think getting out in nature and exercising your body and eating good food. There's a lot of research on nutrition and its impact on mental health. That's not a solution for everything.
Yeah.
But certainly those things are crucial. And it's very easy in our world where people are trying to sell us the next product, which may not be healthy for us. It may not be good for us. It may consume our time and attention. And it's easy to watch 10 episodes of something on Netflix rather than go outside and, play a game of tennis.
That's the whole point. Yeah. Yeah.
And those are just really important things, and they sound so obvious that it's almost like, oh yeah, just go out and exercise. Everyone knows that. But most of us would do well to do more of that, including myself. So I think those are really important. I think there are also on the more acute side, there's some really, really great new therapies coming to help people who are more on the serious side, like TMS, transcranial magnetic stimulation of the brain. There are protocols now that in many cases, have been able to cause remission in major depressive disorder in 1 day of treatment, a week of treatment, where previously those were very difficult cases. They were treatment resistant. There's just some really interesting pharmacological and non-pharmacological solutions coming that give me a lot of hope that people who've really struggled with serious mental illnesses that have really impacted their lives can get rapid help. And so I think we are really moving into a world where even though the need and the demand seems to be increasing because of, there are a million causes to that, I think there's a lot of hope coming, both from sort of AI helping with talk therapy, scaling clinicians who are already providing care by reducing administrative burden, and that is new treatment solutions are coming as well. So I'm very optimistic actually about the ability for people to navigate these challenges where there just wasn't as much hope before.
And I like the fact that you also make that statement that many of those things are actually obvious, right? Going to nature, doing sports, having less of the tasty but unfortunately very processed food and rather go for healthier choices and the like. And still humans are not doing it enough, right? So I'm totally convinced that behavioral science will also need to play a way bigger role in managing health going forward. I don't know what your perspective is, but if we don't find ways to subtly nudge people to prevent without them noticing that they are preventing, this is not going to last, because we could have always gone for the apple a day and the sport program a day and the like, but we just don't do it enough.
Yeah, and it's in a way we have an adversarial relationship with companies who are competing for our time and attention, right?
Yeah.
Nobody really makes a lot of money if I go for a run, but if I sit on Instagram and watch ads for 2 hours instead of running, someone's making money from that. And so they're going to employ behavioral technologies to keep my attention and keep me addicted to that. And so there is this strange adversarial relationship I have with the tools that we carry around in our pocket every day they are a pathway for us to learn and educate ourselves and grow and be supported. And on the other hand, they're also trying to entrap us and keep us unhealthy. And we have to navigate that. It's hard. I don't have the solution to that. But at least knowing like, hey, not everything on my phone is good for me. And not everybody's out for my best interests is, I think, a helpful realization.
Absolutely. Many of the solutions do start with education.
Yeah.
So both in the US and Europe, there is often still a gap between the demand for healthcare and also the capacity, on the other hand, to provide this, especially in underserved areas, as said in the US and Europe, but also elsewhere in the world. What role does technology play in making mental health care more accessible, especially for those who may face barriers to more traditional care?
I think we can reduce the cost of care for mild cases, right? I think we will have AI that will help with people who are sitting at home 50 kilometers from their doctor on a waiting list who can't get in, but they can get some support and help while they're waiting. And I think that helps. I think the fact that we have devices that allow us to use telehealth and see a provider maybe across the globe who's an expert in the thing that we're struggling with helps get the right people to care at the right time. I think tools like Videra that are measuring how a person is doing and their progress, not just is somebody depressed, but they got a treatment and are they getting better from that? And if they're not getting better, do we make an adjustment? That used to require an office visit every time to assess, and there were just not enough office visits to go around. Now that largely that can be done, the check-in with the patient can be done. We can find out that they're not responding to the treatment. The doctor can be alerted. They can do a telehealth call in 5 minutes to make an adjustment and let that person sort of get on to the next phase of their treatment without having it to be an official office visit that takes up 30 minutes on the calendar. So I think, technology is really helping reach. I think the other thing that's interesting is how much bias there is sometimes in diagnoses. And this isn't a knock on clinicians because we all have biases. We dealt with this a lot in job interviews. There were biases about what school somebody went to or how nice they look. And the same thing happens in healthcare. There's things like, oh, that's a poor person's disease. This person couldn't have it because they look nice. There's all kinds of things like that aren't objective, that are mythology, but they affect the ability to get someone to the right treatment. And so I think AI can level that playing field and smooth that out and make sure that every minute of a provider's time that's so scarce and so precious is spent on the most important person where they can have the biggest impact, which is why people went into healthcare in the first place.
Since you are really a true expert in this field, and we're seeing rapid advancements in AI, especially around generative AI, that are leading to innovative solutions like Videra and others, and also the emergence of new companies, obviously, globally. Knowing where we stand these days, looking a few years ahead, let's say the next 5 years, what do you believe will be the next major frontier in AI, especially in the realm of medical AI? I mean, what can we look forward to as humans?
I think sort of access to care is one that AI is going to help with. And that means things we've already talked about, like I can pull up my phone and I can get a consult on a condition or on a lab result or something that I'm experiencing from an AI without it having to go to a clinician. And I think that's really important. And a lot of the things can be handled that way. And so we don't want to replace doctors, but we can also take away a lot of the work that they do that isn't them really applying their expertise. It's just answering another question from a patient that they've answered 100 times. Like, that's a perfect job for AI. And then I think AI will help provide some low-level treatment. I think the other thing that we see is that a lot of things that are done aren't actually correct, right? Doctors make mistakes. And, I heard a stat the other day that the half-life of knowledge from a doctor, in terms of all the knowledge you know, when is half of that out of date? That's less than a year for a doctor in traditional healthcare.
Mm-hmm.
That is a rapid rate of change.
Oh.
How can any human being who's seeing patients every day keep up with the latest developments? Right? That's just not possible. And so I think that AI can sort of help us keep up and make sure that the latest science is being applied to people and that we're truly doing things that matter, right? It's very hard for doctors to get feedback today. And I have lots of examples of, where a family member went to a doctor. My father went to an urgent care here in, sort of a small emergency room and got a recommendation that the doctor said, "Oh, you could not possibly have this. Let me prescribe you this." And it turned out to be the wrong diagnosis and the wrong medicine. But that doctor had no feedback loop to learn from that. And AI can sort of help get data back to providers to say, hey, based on what you saw, this should have been the right recommendation, not that. And so I think that's an opportunity for clinicians to get better with AI and learn and keep up in a way that's just not possible today, and make sure that we're truly doing things that get results for this patient. Whereas in the past, there's still too much guesswork and there's not a good feedback loop. So hopefully that makes sense. And the last thing I wanted to say about that is, coming back to the empathy question we talked about earlier, Videra just released a product that listens into the conversation between the provider and the patient. So there's this trend of, can we reduce the administrative burden on a provider and help AI write their clinical note for them based on what happened, so they don't have to spend 5 minutes after typing up a note. AI just goes, hey, here's what happened in the session. Is this right? Do you approve this?
Yeah.
And because so much time is spent writing those notes that could be done with AI. But beyond that, we want to know, did that provider show empathy to the patient? Did they build a therapeutic alliance with that patient? We know that, especially behavioral health, if there's not an alliance between the provider and the patient, the results are dramatically worse. Did the patient understand what they were told? Did the patient feel heard? And then, you want to know that so you can know if you're delivering good care and predict whether the patient's going to get better or not. But also, can we give feedback to the provider and say, hey, you were like a 4 out of 5 today on empathy, but here was something that you did where you could have done better. And I think AI can genuinely help people get better at delivering the human part of healthcare as well.
Hey, Loren, I really enjoyed greatly our conversation. I love the concrete examples that you brought us today, and also very much like the inspiration around mental health in diagnosing, but also solutioning around it. And especially that combination of AI and human, and who is more empathetic, and how can we double down on that, really is great insights. And I really genuinely thank you for your work that you're doing in advancing mental health care, and obviously wishing you all the very best for any success to come. And just for me to say thank you again for taking the time to speaking us today.
Thanks again for chatting. It's been really fun.
Yeah, and that really wraps up today's episode. Thank you very much, everyone, for listening in. If this conversation did spark any new thoughts or questions, I'd really encourage you to share them with us. Please do feel free to reach me on LinkedIn or also through our website. And I'm very happy to continue individual conversations. Please do not forget to subscribe to the Strategy and Insider podcast so you never miss an episode that we fill with expert insights, but also forward-thinking discussions. I truly appreciate your continued support and enthusiasm, and I'm very much looking forward to the next episode. But until then, stay safe and goodbye.
Strategy made real.